All right, so ready to jump into the world of pharmacy assistants.
Let's do it.
Today, we're going deep on what it really takes to be great in this role.
Hmm.
And we've got this really cool resource to guide us. It's like a guide to the 20 most common interview questions and answers.
Oh, interesting.
And you know what? I think it's going to give us a much better understanding of like the day-to-day skills and responsibilities than you might think.
I bet.
We're talking about handling those tricky customers, uh, making sure that every single medication is accurate, and even navigating drug recalls.
Whoa.
Yeah, this is going to be good.
It really does highlight how a pharmacy assistant is, well, more than just someone handing out pills, right?
Yeah,
It seems like a really crucial part of the healthcare team.
for sure.
And there's a huge emphasis on patient safety, which makes sense, and understanding all the different medications.
Yeah, and I think that's a lot more responsibility than people might realize at first glance.
Yeah, absolutely.
You're dealing with people's health, right?
Right.
So accuracy is, well, it's everything.
Totally.
And the guide actually talks about the potential consequences of even like a tiny error,
Oh, like what?
like misplacing a decimal point when you're entering a dosage.
Oh, gosh.
And that could have really serious consequences for a patient.
Yeah, absolutely. And when you think about like the volume of prescriptions that a pharmacy handles every single day,
Oh my gosh, yeah.
I mean, the need for precision and attention to detail is just, it's so apparent.
Huge.
It's not just about following instructions. It's a
Mhm.
real commitment to patient well-being.
It is. It's like you're not just a dispenser, you're a guardian of safety.
I like that.
And
Right.
speaking of situations where accuracy is just absolutely paramount, the guide also delves into handling controlled substances.
Oh, yeah. Now those have a whole other layer of responsibility.
Definitely.
Strict protocols, meticulous documentation, it's essential.
It's a whole different ballgame.
It is.
When you're dealing with medications that have a high potential for misuse,
For sure.
it's like you're walking this tightrope between patient needs and legal requirements.
Yeah,
I can imagine that can get pretty intense,
it definitely does.
especially when you consider, the potential for things like forged prescriptions or
Right.
customers trying to pressure you into dispensing more medication than they're prescribed.
Oh, I see.
Yeah.
It requires a certain level of vigilance and a solid understanding
Yeah.
of those regulations.
Yeah.
You got to be able to spot red flags
Uh-huh.
and know when to involve the pharmacist.
It's like you're a detective almost,
Find it, yeah.
constantly analyzing situations
Right.
and making judgment calls based on your knowledge and experience.
Absolutely.
Now, on a bit of a lighter note,
Okay.
the guide also emphasizes the importance of customer service skills.
Which makes sense. I mean, you're often the face of the pharmacy.
Exactly.
You're interacting with people from all walks of life,
Yeah.
often when they're not feeling their best.
Well.
Right. Stressed, unwell.
Mhm.
So empathy and professionalism are so important.
I bet you encounter like a whole range of personalities and situations.
Oh, for sure.
The guide mentions dealing with like those angry or frustrated customers.
Yeah.
And I'm curious, how does it suggest navigating those interactions?
Well, it really emphasizes active listening
Okay.
and trying to de-escalate the situation,
Mm-hmm.
understanding where that frustration is coming from and finding a solution,
Right.
that addresses their concerns, but stays within the pharmacy's guidelines.
So it's like balancing empathy with
Yeah.
the need to follow procedures.
It is.
But how would you handle a situation where a customer is being like truly disruptive
Oh,
or even abusive? Is there a point where empathy has its limits?
right. That's a great question.
Yeah.
It does raise the issue of where you draw the line.
Yeah.
While the guide stresses de-escalation, it does acknowledge that sometimes you need to involve the pharmacist or even security
Right.
for everyone's safety.
It's a delicate balance.
It is.
It sounds like knowing when to escalate a situation is a pretty key skill.
Definitely.
Speaking of skills, the guide also mentions the need to stay up to date on all the pharmaceutical regulations.
Of course, healthcare is a constantly evolving field.
Mm.
You need to be on top of the latest developments.
Yeah.
The guide recommends reading industry publications, attending conferences.
Makes sense.
Yeah, new medications, regulations, technologies.
That makes sense, especially with new drugs and treatments being developed all the time.
All the time, yep.
Now, what about the technical aspects of the job? I mean, pharmacies are pretty high-tech these days, aren't they?
They definitely are. The guide talks about using software programs for managing inventory, processing prescriptions,
Wow.
even tracking potential drug interactions.
So you're not just dealing with the medications themselves.
Right.
You're also dealing with data entry and computer systems.
Absolutely.
I bet that takes a lot of attention to detail, a lot of accuracy.
It does. One wrong keystroke could have big consequences.
Gosh, yeah.
And speaking of specialized skills, the guide also touches on the world of compounding medications.
Compounding.
Yeah.
That sounds pretty intricate. What exactly does that involve?
Essentially, it's the art and science of creating custom medications for patients with very unique needs.
Okay.
So imagine someone with allergies to certain ingredients, or they need a specific dosage that just isn't commercially available.
Oh, I see.
Yeah.
It's like you're like a pharmaceutical chef whipping up custom-made medications.
In a way, yeah. It requires a very high level of precision and knowledge about ingredients, how they interact.
Wow.
Not every pharmacy assistant will work with compounded medications,
Mm-hmm.
but it's a fascinating area if you're looking for more specialized skills.
Yeah, so you could start as like a general pharmacy assistant and then maybe branch out into compounding later on.
Exactly.
Add another layer to your expertise.
Right.
Speaking of expanding your knowledge, the guide asks this really thought-provoking question
Okay.
about what you would do if you suspect a customer might be abusing their medication.
Ooh, that's a tough one.
It is a tough one.
That's a very sensitive situation.
Yeah.
And the guide recommends a really careful approach.
Like what?
Speaking to the customer non-confrontationally, trying to understand their situation, and then potentially consulting with the pharmacist or physician.
So it's about walking that fine line between concern for the customer's well-being
Mm-hmm.
and the ethical responsibility of ensuring medication safety.
It is.
That must be difficult to balance.
Yeah, it requires a lot of sensitivity and judgment. You're not there to judge, but you do have a responsibility to ensure that those medications are being used safely and appropriately.
Absolutely. It's a reminder that this job is about so much more than just dispensing pills.
It really is.
You're a problem solver, a communicator, a patient advocate, sometimes even a detective.
Exactly.
And we're just scratching the surface here.
I know, right?
There's so much more to unpack when it comes to the skills and responsibilities of a pharmacy assistant. Well, let's keep digging. I'm really curious to learn more about how a pharmacy assistant manages the chaos of a busy pharmacy,
Okay.
especially when there are multiple customers all needing attention at once.
That's a great place to pick up.
Ah.
Imagine a packed waiting area, phones ringing off the hook, and you're trying to juggle all these tasks while staying accurate and calm.
It sounds like organized chaos, like trying to conduct an orchestra while riding a roller coaster
Yeah.
without the musical talent or a safety harness.
You got it. Yeah,
Why?
you can definitely feel that way sometimes.
Wow.
But that's where prioritizing tasks and staying calm under pressure, that becomes so important.
Right.
The guide emphasizes how important it is to quickly assess each customer's needs
Uh-huh.
and determine who needs help first.
So it's like triage in an emergency room.
Yeah, exactly.
You got to figure out who needs immediate attention and who can maybe wait a little bit.
Right, exactly. Is someone picking up a simple refill, or do they have a complex insurance issue that needs resolving? You're constantly evaluating and adjusting priorities as new people come in and situations change.
I bet clear communication with your colleagues is essential in that kind of environment.
Oh, absolutely. Teamwork is key in a busy pharmacy. And speaking of teamwork, the guide also highlights the importance of managing medication expiration dates.
Oh, right.
Might seem like a small detail,
Yeah.
but huge implications for patient safety.
It's not just about checking dates on bottles, is it?
No, it's about having systems in place
Right.
to ensure that no expired medication ever reaches a patient.
Gotcha. So it's being proactive
Right.
rather than reactive.
Exactly. Think color-coded labels, electronic reminders, meticulous documentation to track those expiration dates and make sure everything's rotated properly.
So it's like a constant game of inventory Tetris,
It is.
making sure everything's in its place and nothing gets lost in the shuffle.
Exactly. And that level of organization is so crucial, especially when you consider, just the volume of medications a pharmacy handles
Gosh, yeah.
and the potential consequences of dispensing expired products.
Okay, let's tackle another common pharmacy challenge, insurance issues. I'm sure everyone listening has been there at some point, standing at the counter with a prescription,
Uh-huh.
only to find out there's a problem with their coverage. Talk about frustrating.
Oh, it can be a real headache for both the customer and the pharmacy staff.
Yeah.
But the guide really emphasizes the importance of taking a problem-solving approach.
Okay, so what does that look like in practice?
First, you need to understand the problem.
Mm-hmm.
Is it a misunderstanding about the policy? Has the coverage changed?
Mm.
Is a prior authorization required? Once you've identified the issue, you can start exploring solutions.
So it's like you're a detective again,
Yeah.
but this time you're investigating insurance policies instead of medication interactions.
Exactly.
Yep.
You might need to contact the insurance provider, research the specific policy, or even work with the customer to find like alternative payment options or manufacturer discount programs.
It sounds like being a pharmacy assistant requires you to wear a lot of different hats.
It does.
Detective, diplomat, insurance expert, inventory manager, the list goes on.
It's a multifaceted role.
Mm-hmm.
And let's not forget that even the most skilled and experienced pharmacy assistant
Yeah,
can make mistakes. It's human.
that's got to be a tough situation to face.
Yeah.
Knowing that even a small error could have serious consequences.
Who could?
What does the guide recommend in terms of handling those situations?
Honesty and transparency. If you make a mistake, own it immediately.
Wow.
Notify the pharmacist or supervisor
Okay.
and take steps to correct it.
So it's not about trying to like cover it up or downplay the situation.
Absolutely not. It's about taking responsibility and focusing on patient safety. The guide emphasizes that being willing to acknowledge mistakes and learn from them, that's a hallmark of a true professional.
It's about turning what could be a negative situation into a positive,
Right.
demonstrating integrity and a commitment to continuous improvement. Now let's switch gears and
Okay,
talk
yeah.
about something that might not happen every day,
Right.
but when it does, it's all hands on deck. Drug recalls.
Oh, yeah. Those can be intense,
Yeah.
requiring a high level of coordination and attention to detail.
So what are the key things a pharmacy assistant needs to know about handling a drug recall?
It starts with having clear procedures in place.
Mm-hmm.
You need to be able to quickly identify the recalled medications, remove them from inventory, and contact affected customers.
So swift action and accurate documentation.
Exactly. You're playing a role in protecting public health, ensuring that those potentially harmful medications are taken off the market and out of circulation.
It's another reminder of the immense responsibility that comes with this job. Now, the guide also delves into some more nuanced aspects of the role,
Like what?
like explaining complex medical information to customers.
Oh, right.
That can't be easy,
It's not.
especially when you're dealing with people who might be anxious or overwhelmed by their health concerns.
It definitely requires strong communication skills
Hmm.
and a talent for, well, translating medical jargon into everyday language.
So you're not just dispensing medications, you're also acting as a translator and educator,
Yeah.
helping people navigate the often confusing world of healthcare.
It's about empowering patients to take an active role in their own health
Yeah,
by giving them the information they need to understand their medications and treatment plans.
I like that. And speaking of empowering patients, the guide asks a question about what you would do if a customer isn't compliant with their treatment plan.
That's a sensitive one.
It is. It must require a lot of tact and diplomacy.
It does. It's not about lecturing or judging the
Okay.
customer. It's about trying to understand why they might not be following their treatment plan.
Right.
Maybe they're having trouble affording the medication,
Oh, okay.
or they're experiencing side effects that make it hard to take as prescribed.
So it's about getting to the root of the problem and working with the customer to find solutions.
Exactly. And it might involve talking to the pharmacist about alternative medications, exploring financial assistance programs, or even just providing more education and support so they feel more comfortable with their treatment plan.
It's about building trust and rapport.
It is.
So the customer feels comfortable opening up about their concerns and challenges.
That's a crucial part of being a successful pharmacy assistant.
Yeah.
You're not just filling prescriptions, you're building relationships.
Right.
You're advocating for patients.
Now, before we move on to the final part of our deep dive,
Okay.
I want to touch on another technical aspect of the job that the guide mentions,
Right.
verifying that a prescription has been filled correctly.
Ah, yeah, that's crucial.
It is.
It requires meticulous attention to detail.
So what are some of the things a pharmacy assistant needs to check to ensure that accuracy?
You need to verify the patient's information, the doctor's orders, the dosage and quantity of the medication, and any potential drug interactions. You're creating a safety net to catch any errors
Hmm.
before the medication gets to the patient.
It's almost like being a proofreader.
It is.
For medications, just meticulously scanning for inconsistencies or potential problems.
And that vigilance is essential.
Yeah.
A small mistake could have serious consequences, so you can't afford to let anything slip through the cracks.
It's another reminder of the crucial role that a pharmacy assistant plays in ensuring patient safety.
It is.
Okay, let's take a deep breath
Okay.
and dive into the final part of our exploration, where we'll unpack even more insights from this interview guide and really explore the future of this dynamic and evolving profession.
All right, I'm ready.
Okay, so we're back for the final part of our pharmacy assistant deep dive.
Here we go.
We've covered a lot of ground, from dealing with those tough customers and insurance issues to accuracy with meds and even handling those drug recalls.
Yeah, it's been a journey.
It really has. And, through it all, I think we've seen how this role just demands like a really unique blend of skills.
Yeah.
Technical expertise, interpersonal skills, and just this deep commitment to patient well-being. It's more than just a job.
It is.
It's like a vital part of healthcare.
Absolutely.
And one thing that's become really clear is that this role, it requires a willingness to constantly learn and adapt. I mean, pharmaceuticals, they're constantly evolving. New meds, new technologies, new regulations.
All the time, yeah. You have to be comfortable embracing change and constantly expanding that knowledge base.
Right, exactly. And the guide even touches on the use of technology in pharmacies,
Oh, right.
highlighting how software programs are becoming so important for managing inventory, processing prescriptions, even flagging those potential drug interactions. So you're not just, knowing your medications, you also got to be pretty tech savvy,
You do.
comfortable navigating those digital systems, which I imagine adds like a whole other layer of responsibility.
It does. One wrong keystroke and, well, you know the consequences.
Oh, yeah. Big time.
But on the flip side, technology can also be a really powerful tool for enhancing patient safety
For sure.
and streamlining all those pharmacy operations.
It's like a double-edged sword, right?
It is.
Powerful, but it demands careful handling.
Absolutely.
Speaking of demanding, there's this one question in the guide that really stuck out to me as being particularly challenging.
Okay, which one?
It asks how you would handle a situation where a customer refuses to wear a mask in a pharmacy that requires them.
Ooh, that's a tough one. Especially with all the, well, the debates around masks.
Right. It's like this constant tension between, public health guidelines and individual rights. How do you balance that?
Yeah, it's like walking a tightrope. You want to enforce those rules, but also maintain a positive customer experience.
So how does the guide recommend you navigate that kind of conflict?
It emphasizes a calm and empathetic approach. You start by politely explaining the pharmacy's policy and the reason behind it, and maybe offer alternatives like curbside pickup or delivery if the customer just won't comply.
So trying to find a compromise
Yeah.
that prioritizes safety without, alienating the customer.
Exactly.
Which I guess brings us back to this core idea we've been talking about, that being a pharmacy assistant is about so much more than just filling those prescriptions.
It really is.
It's being a communicator, a
Yeah.
problem solver, an advocate for patients, and a guardian of safety. It's about being adaptable
Absolutely.
and resilient in the face of all these changes.
Time, yeah.
Well, as we wrap up our deep dive, I want to leave everyone with a thought-provoking question.
I like it. Let's hear it.
The landscape of healthcare is constantly changing. New technologies, treatments all the time. So what new skills and challenges do you think future pharmacy assistants might need to navigate?
Well, as personalized medicine becomes more common, maybe they'll need to become experts in interpreting genetic data, like tailoring medications to each patient's profile.
Oh, wow.
And maybe they'll even play a bigger role in patient education, counseling people on new therapies and how to manage the side effects of those cutting-edge treatments.
That's a good point. What about with the rise of telehealth?
Oh yeah, with telehealth and remote monitoring, maybe they'll have to be really good at virtual consultations, providing support to those patients from a distance.
Wow, the possibilities are pretty incredible. But one thing is for sure, the role of the pharmacy assistant, it's going to keep evolving and become even more important in this world of healthcare.
Absolutely. So if you're interested in a career that combines science, compassion, and offers that constant opportunity for growth, well, pharmacy assistant might be the perfect path for you.
Absolutely. Well, I think that wraps up our deep dive into the world of pharmacy assistants. Hopefully, this has given everyone a better understanding of the skills, the responsibilities, and the challenges that come with this job.
It's been great exploring it all with you.
And remember, this is just the beginning of your journey. Just keep learning, keep asking questions, keep exploring the world of healthcare, and who knows what amazing opportunities are out there.